The latest initiatives aim to add another layer to those introduced recently, so that fewer people unnecessarily access the health services and bog down the system. The GHA claims the recently introduced repeat prescription service has already resulted in 300 appointments fewer. The new 6-certificate service will start next week and will run from 9 to 4, Monday to Friday.
Today we've announced a series of measures, the first of which is that we've introduced a telephone line for people who have self-limiting minor illnesses that can call a trained nurse to ask for a sick note. The trained nurse, of course, will ask all the pertinent questions, and if she or he agrees, then they will issue a sick note for no more than 2 days, which has to be continuous days. In other words, you can't ask for a sick note for the Friday and also have the Monday. You can only ask for a sick note for a maximum of 3 months, in other words, a maximum of for a year.
Statistically, there is a culture in Gibraltar of people asking for sick notes. Isn't this open to abuse? Isn't this encouraging people to just ask for a sick note and they don't even have to be seen by any medical professional?
Well, remember, Christine, that every system is open to abuse, but I think that we have built the right safeguards into the system, as I said, by ensuring that the sick note can be for no more than 2 days. That means that we are well within the safety margin. Also, that you can't ask for it for more than 4 times in a year. Remember that somebody who wants a sick note but he or she is not actually ill may want a sick note for an even longer period. For that, you can't call this particular line. You will need to attend. Also remember that we have around 350 people who attend A&E every month that are not there for an accident or an emergency, but nonetheless request a sick note. And unlike the UK, our A&E don't turn any people away. So the reforms that we've introduced over this month alone is to ensure that the appointment systems in the PCC works, that we relieve pressure from the PCC and from A&E, and also in accordance with the public health message. If you have a minor illness, the message always is don't go to work, don't go to the PCC, and of course if you do require to submit a sick note at work, then this is the best way to achieve that.
The key with this one is that I'm not providing really medical care. We are, as GPs, not providing care. We are providing a piece of paper. And so this does 2 things. Firstly, it makes it better for the patient concerned because they can stay at home, they can stay warm, they can take their fluids and their Panadol, self-care. And secondly, it frees up an appointment with somebody who is genuinely ill. And this is really underpins all of this. What we're trying to do is provide better access for people that genuinely need to see their doctors, and the people that don't need to see a doctor with the repeat prescription service, for example, or with a telephone sick note, don't need to see them.
The project to digitise paper patient notes and upload the information to individual electronic records is expected to take between 3 to 6 months.
A patient's file will now be digitized so that the GP, at the press of a button, will be able to see the entirety of that patient's history on the screen. The online functionality will allow for searches so that it is even better in the short time the GP has to be able to search those medical notes properly. And the key and important reform that comes from this is the fact there will be 4 PCC clerks who will be released from getting the notes, taking it to the GP, then of course getting it back from the GP and filing. They will release those 4 clerks to be able to attend to telephone lines and the counter, therefore improving the quality of the customer service that we provide at the PCC.
Further announcements are due over the next few weeks.